Uterine atony, or relaxation of the uterus, is the most frequent cause of postpartum hemorrhage. So for today, I'm going to show you 2 ways on how to manage uterine atony. So in the event of uterine atony, the first step in controlling the hemorrhage is to attempt fundal massage to encourage contraction. Unless the uterus is extremely lacking in tone, this procedure is usually effective in causing contraction. And after a few seconds, the uterus assumes its healthy grapefruit-like feel. For the assessment phase, first is to assess the woman with factors that predispose to poor uterine tone or inability of her uterus to maintain a contracted state, such as conditions that increase for postpartum hemorrhages. Next, obtain the mother's blood pressure and heart rate. Blood pressure drops abruptly due to vaginal bleeding. Check for loss of blood that leads to hypovolemic shock, such as falling blood pressure, a rapid, weak or steady pulse, increased and shallow respirations, pale, clammy skin, and increasing anxiety. Lastly, estimate the amount of blood by counting number of perineal pads saturated in given lengths of time, such as half-hour intervals. A rough estimate of the amount of blood loss can be formed. For the planning phase, explain the necessity for the procedure and provide privacy. Position the woman on her side when inspecting for blood loss to be certain a large amount of blood is not pooling undetected beneath her. Lastly, palpate a woman's fundus at frequent intervals to be assured her fundus is remaining contracted. Good day, ma'am. I am Angelica and I will be your nurse for today. May I know your name and your birthday, please? Thank you, Ma'am Ezra. So, I will render a fundal massage to control the vaginal bleeding and encourage uterine contraction. Is that okay? Thank you, ma'am. So, how are you feeling? Just relax, okay? So, this procedure helps to decrease anxiety and enhances self-esteem. So, before we begin the procedure, ma'am, I will assist you to urinate to lessen the pressure and avoid discomfort, okay? Thank you, ma'am. So, an empty bladder prevents displacement of the uterus and ensures accurate assessment of the uterine tone. Ma'am, may I assist you to lie on the bed with your knees flexed, okay? Thank you, ma'am. Just relax, okay? Proper positioning enhances visualization and effectiveness of procedure. Ma'am, I am going to start to massage your fundus by placing my one hand on your abdomen just above your symphysis pubis while my other hand is around the top of your fundus. This anchors the lower uterine segment and allows you to locate and assess the fundus. Ma'am, I am now rotating my upper hand to carefully massage your uterus in order to encourage uterine contraction. Massage should be done only when the uterus is not firm, and aggressive massage may lead to a partial or complete uterine prolapse. Okay, ma'am. So I can now feel the uterus is firm. I will now press the fundus between my hands with a slight downward pressure against my lower hand. Gently squeezing with downward pressure helps to expel blood or clots collected in the uterine cavity. Okay, ma'am. So, please allow me to check your perineum in order to remove the passage of clots and Estimate the amount of your vaginal bleed. This helps to assess the degree of bleed. Okay, ma'am, we are almost done. I will do a fundal massage one more time just to make sure that your uterus is firm. So I am now done with the procedure. I will now clean your perineum and afterwards I will apply a clean perineal pad. So this helps to promote comfort and hygiene while reducing the risk for infection. After the procedure, I will document the result and I will continue to assess the fundus and lochia, and I will notify the primary care provider if the fundus does not remain firm or if the bleeding continues. So documentation provides a means for evaluation, and continued assessment allows for early identification and prompt intervention with additional measures such as oxytocin to prevent hemorrhage. Okay, so we are now done with the fundal massage procedure. So if this procedure is not effective, then we will proceed to the next management, which is the uterine balloon tamponade. This is a balloon technology that is being used to tamponade the uterus to control postpartum hemorrhage. This involves inserting a rubber or silicone balloon into the uterine cavity and inflating the balloon with normal saline. For the assessment phase, assess the woman's status and assess the client's ability to follow instruction. First, I will gather all the items that I will need on this procedure for easy accessibility. So, we have here 2 sterile gloves, iodine, saline solution, Foley catheter, and a 50cc syringe. Good morning, ma'am. I am Angelica and I will be your nurse for today. So we will be doing an emergency management for your postpartum hemorrhage by making a uterine balloon tamponade. So I will make a balloon tamponade and I will insert it into your uterus to stop the bleeding. So ma'am, I want you to relax, take a slow deep breath and stay still, okay? Is that okay? Thank you, ma'am. Thank you, Ma'am Ezra. So this procedure helps to relieve anxiety and apprehension. Ma'am, if you can stand up to urinate in the bathroom, I can assist you. But if you feel dizzy, I can offer you a bedpan or I can insert a catheter to help you urinate. Is that okay? Thank you, ma'am. So a full bladder can weaken contractions and delay the separation of the placenta. I will assist you to lie down on your bed with your legs apart, okay? Thank you, ma'am. And I will drape what is not needed to be exposed. This procedure is for easy visualization and provide privacy. Ma'am, so I will start an intravenous infusion to restore the blood loss, and I will mix a medication to your intravenous fluid to help your uterus to contract, okay? This procedure is to restore the blood loss and treat shock, and to keep the uterus well contracted, and to prevent hemorrhage or to stop the bleeding. Next is I will wash my hands. Then I will put an antiseptic solution over the thigh, and I will put on sterile gloves. This protects me by preventing any accidental contact of a substance that could carry a microorganism through break in my skin. I will now start making a uterine balloon tamponade by inflating the Foley catheter. This is to check if there is a leakage on the inflated balloon. I will insert the deflated balloon, then I will inflate the balloon by sterile saline solution up to 500 ml until it can be seen in the cervix. So this is what it looks like after inflating a 500 ml saline solution. So let's assume that it is already seen in the cervix. Then I will clamp the catheter. Then I will tape it to the patient's thigh for gentle traction. I will connect the drainage port of the catheter to the fluid connecting valve. To monitor the amount of blood loss. Then we will unclamp. After the procedure, I will remove my gloves and wash my hands for infection control. I will continue to monitor the client's vital signs, urine output, fundal height, vaginal bleeding, and the amount of blood loss. This is to monitor if the client is experiencing hypovolemic shock. And lastly, I will document the procedure on nurse's notes. And if the bleeding did not subside, I will refer the client to a CMAM facility. This is to provide accurate data in the care of the client. That's all. Thank you. Uterine atony, or the relaxation of the uterus. Huwag kayo maingan! Ano ba? Dito kaya. Wala, ano po ito hot sauce. So, lagyan natin ng plastic para hindi madami natin hindi siya. Alright, okay. Please flex tayo, mama. Okay, alright. After the procedure, I will document the result, and I will continue to assess the fundus and lochia, and I will notify ano ba? Second management, uterine balloon tamponade. Charlotte. After the procedure, I will remove my gloves